Measles now in Kentucky, where health officials say they have confirmed a case in an adult who recently traveled internationally to an area with ongoing measles outbreak. Meanwhile, the outbreak in Texas has officially claimed the life of a child now. State health officials are confirming the first death, a school-aged child who was unvaccinated. This as the number of infected grows to 124, with most cases being children. Joining me now, I have NewsNation medical contributor Dr. Dave Montgomery, board-certified cardiologist. Dr. Dave, it's always good to see you. Just for starters, how significant is it that the measles outbreak has now turned deadly for the first time in a decade? I mean, I'm just so sorry for this family.
Yeah, and if you think about it too, the last time a child died was the early 2000s. So we're talking about even longer. That was an adult in 2015. So I think it really should grab our attention here. And what is causing this? And I think, we all point to the sort of coverage of vaccines as being the main one. And I think that just sort of stems from misinformation, disinformation, and this part, Markie. If you think about it, the disease was rendered eradicated in the early 2000s, and we just didn't see it. If you don't see the condition, you don't think that it's there. You don't have a really guttural response to it. I think added with the people who just can't take the measles vaccine for other reasons, we're seeing outbreaks in the United States.
And, just kind of zeroing into this community in Texas where this outbreak is really happening, this is a rural, tight-knit Mennonite community. Many of them claim religious exemption, they don't like vaccines. The vaccination rates are below the threshold required for herd immunity there. So if that's the case, Dr. Dave, I mean, how does this community recover from this right now?
Yeah, it's a really difficult thing, and public health officials on the, in that region really are going to be key to this and sort of isolating the disease. It is likely that they, as we kind of talked about in the lead, that they, sort of got the disease, this variant of the measles from somewhere in Europe is where this genotype is thought to be, and then it just sort of spreads, right? So if you travel and you don't have a measles vaccine to an area that's got a new variant that could be more deadly, for example, this one, you'll bring it back to the United States. How do we wall that off and keep other communities away from that? That's the public health's job.
Before I let you go, just one more question. Your message to parents this morning, especially after COVID, there are a lot of families that are skeptical of vaccinations. What do you tell parents who are trying to decide whether the MMR vaccine is right for their child?
Yeah, Markie, it'd be easy for me to just say, go get vaccinated. I think every parent is wanting to do the very best thing for their child. I want them to consider one thing. Are they themselves vaccinated against measles? And the answer likely is the large majority of them are. And then I want you to think of the downsides of not vaccinating them. We're sort of hearing some of this misinformation about the downsides of taking it, which are probably not founded in data. The downside of not getting a measles vaccination is death or long-term neurodevelopmental problems, as well, things like pneumonia. There's a real consequence to not fighting this with the best tool that we have, which is a vaccine. Go speak with your pediatrician and ask, for my child, is there a reason that I should not give a measles vaccine? And if not, go ahead and do it.
Yeah, consult your doctor. Dr. Dave Montgomery, I got to end it there. Thank you as always. Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.